Hi, and welcome to our Healthy Living class series. My name's Marnie. I'm a registered nurse with the Loyalist Family Health Team, and I'm going to start off with the first video in our Healthy Living class series, learning how to live well with diabetes and prediabetes. There will be a few videos for you to check out, so please watch for those. Today's class or lesson is going to be part 1. So we're going to review the diabetes basics, kind of what is diabetes and some information there. There is a part 2 for the Healthy Living class, and that is with our registered dietitian, Carolyn. So she's going to go over all things food and nutrition. So please watch that video as well. There is also a few other videos with our registered nurse, Erin, who goes over foot care as well as sick day management. So what to do when you have diabetes and you're sick. So today, for part 1, we are going to go through what is diabetes, what are some signs of diabetes, what are some problems from having diabetes, what do your numbers mean? So when you're having your doctor's office and they mention certain numbers, what do those kind of mean and why are they significant, as well as what are some things that you can do to live healthier with diabetes. So first, to start off, we're just going to start off with a basic definition of diabetes. So this is straight from the Diabetes Canada website, and they describe diabetes as a disease in which your body either can't produce insulin or can't properly use the insulin it produces. Insulin is a hormone produced by your pancreas, and insulin's role is to manage the amount of glucose or sugar in the blood. Blood sugar must be carefully managed to ensure that the body functions properly. Too much blood sugar can cause damage to organs, blood vessels, and nerves. Your body also needs insulin in order to use sugar for energy. So what does that definition really mean? I think it's important that in trying to understand what diabetes is, it's essential to understand how the body uses glucose or sugar for energy. So the diagram on your screen gives a basic example of how the body uses sugars when it's functioning normally. So as you can see, it starts with you eating a food that contains sugar or carbohydrates. The body breaks that food down into its simplest form. So a carbohydrate like a banana is going to be broken down into glucose, which is just a fancy word for sugar. Those sugar molecules will then enter the bloodstream and are delivered throughout the body. The pancreas makes and releases a hormone called insulin into the bloodstream, which is used almost like a key to help open up the doors of the body's cells, and this allows the sugar molecules to leave the bloodstream and enter the cell. The sugar is then used as energy for the cell to perform its main function. So this diagram will show you what happens during this process when someone has diabetes, so how it's different. It's going to start the same way with you eating food that contains sugar or carbohydrate. The body's then going to do the same thing and break that food down as it normally would into sugar molecules. Those sugar molecules will enter the bloodstream as normal and begin to move throughout the body. However, this next step is where things change. So with diabetes, the pancreas may not be making as much insulin as it normally would, or your body may not be able to use that insulin as well as it normally should. So this is called being insulin resistant. Therefore, your body may have less insulin keys, or those insulin keys may not work as well to open the cell doors, allowing the sugar molecules to leave the bloodstream and enter the cells. So because those doors are not opening as often to let the sugar into the cells out of the bloodstream, it leads to a buildup of sugar molecules in the bloodstream, and this leads to high blood sugar. So another way that you could think about it is like a freeway. So imagine normally, as you can see on the left, there are lots of exits to allow the sugar molecules or cars to get off the freeway or out of the bloodstream as they like. So things can flow freely and there's not a buildup of sugar in the bloodstream. But with diabetes on the right, it's almost as if some of those exits are blocked, or there's not as many exits, so the cars or sugar molecules cannot get off the freeway or out of the bloodstream easily, and this leads to a bit of a traffic jam. So high blood sugar means that there's a high amount of sugar molecules in the bloodstream. So before we go any further, I do want to clarify that for this presentation, we are specifically going to be talking about only one certain type of diabetes, and that's type 2 diabetes. A lot of people aren't aware, but there is 3 different types of diabetes. So type 1 is when the pancreas does not produce any insulin. Therefore, someone with type 1 diabetes needs to be on insulin injections daily to help control their blood sugar. This type of diabetes is most often diagnosed when someone is a child or a young adult. Type 2 diabetes is the most common type of diabetes, and it consists of about 90% of all diabetes cases. And this is going to be the type of diabetes, like I said, that we are going to be talking about in this presentation. Type 2 diabetes is when the pancreas doesn't produce enough insulin, but it still does produce some, or the body is insulin resistant, meaning that the body cannot use the insulin as well as it should. The third type of diabetes is called gestational diabetes, and it's when someone develops a temporary form of diabetes just during pregnancy. Most often, this diabetes ends when the pregnancy is over, but it's important to know that it can increase a woman's risk of developing diabetes later in life. Lastly, I do want to mention that there is also something called prediabetes. And this is when there are signs that your blood sugar is slightly above normal, but it's not yet high enough to diagnose you as having diabetes. Often, with some lifestyle changes, someone with prediabetes can return their blood sugars back to a normal level. So, what causes diabetes? This is always a big question. Many people have heard the myth that eating too much sugar is what causes someone to have diabetes, but this is just that. It's a myth. It's not the cause. Diabetes is not caused by eating too much sugar, but if you're predisposed to developing diabetes, you already have those risk factors to getting diabetes, a high sugar diet can contribute to you showing signs of diabetes sooner. So sugar is not the cause, but it can have an effect on how soon you do show signs of diabetes. There are actually many risk factors that a person can have that will make you more likely to develop diabetes instead of somebody else. So some of these risk factors are, first of all, if you have a family member, specifically a parent or a sibling that does have diabetes, you are at an increased risk. If you're over the age of 40, so we do have, our risk does increase as we age for developing diabetes. As well, if you're not physically active and you're overweight or obese, you'll be in a higher risk category for it. If you're a female who has had diabetes when they were pregnant, so like I mentioned previously, it does increase your risk of getting diabetes later in life. As well, if you're in a high-risk ethnic group, you may be at a higher risk of getting diabetes. So how are you supposed to know if you have diabetes? What are some things that you could feel so that you know that you have diabetes? So this one's always a little bit tricky. Diabetes is always diagnosed after having blood tests done, but there are some signs and symptoms that can be clues that your blood sugar is higher than normal. So things that you could notice that might be clues that we need to check your blood for high blood sugar. So some of these are fairly subtle and you might not notice them right away. But these signs are increase in hunger, always feeling thirsty, peeing more than usual, dizziness, unexplained weight loss or weight gain, and numbness or tingling in your hands and feet. Some other things you might notice are an increase in frequency of yeast infections, blurry vision, changes to your skin or skin issues, cuts that seem to heal really slowly, sexual problems, or a high blood sugar reading if checked on a glucometer. So after being diagnosed with diabetes, it's then important to understand what problems could arise from having diabetes, because this will help you to know why it's really essential to try to keep your diabetes under control. So we really want to know, what are we trying to prevent by keeping our blood sugars at a certain level? So when your blood sugar is high, meaning there's an excess amount of sugar molecules in your bloodstream, those extra sugar molecules can damage your small blood vessels and nerves throughout the body. So all of this damage that can be done to those small blood vessels and nerves can lead to other bigger problems, such as blood vessel disease of the brain, heart disease, kidney damage, nerve damage, blood vessel disease in your arms and legs. It can damage your eyes as well as cause issues with your feet. So it's really important to be trying to manage your blood sugars, because the more often that your blood sugars are well controlled using either healthy lifestyle practices and or medication, the lower your risk of these problems occurring is going to be. All right, so now let's look at your numbers. So the sheet that you're seeing on the screen, if you don't have this sheet, if we haven't sent it to you already, and you would like a copy of it so that you could see your most recent numbers, you are welcome to contact your physician, your family doctor's office, and just ask them to put you in touch with their diabetes nurse, and they can fill it out and send it to you, so that you can kind of check your numbers against this and just see where you stand. But these are all really important numbers that we look at your diabetes visits or with your pre-diabetes blood work, just to make sure that you're within target in as many of them as possible. So if you do have this form, definitely pull it out and we'll go through it together. The main numbers that we're going to look at regularly are the hemoglobin A1C, the fasting blood sugar, your cholesterol levels, which is broken down into different parts, as well as your blood pressure. So we'll go through kind of what each of these mean here in a second. So the biggest thing is that you're going to have regular blood tests done when you do have prediabetes or diabetes. We always are going to diagnose prediabetes or diabetes from your blood test. That's where we're going to get that information to be able to make that diagnosis. And it comes from checking the amount of sugar in your blood. So with your fasting blood sugar, we want it to be below 7. And your hemoglobin A1C, it's going to give us a little bit of information about where you're sitting, and if you're within normal range, the prediabetes range, or the diabetes range. Prediabetes is anything 6.0 to 6.4. Once you're 6.5 or higher, it does put you into that diabetes range. And these blood tests also help us to monitor how well your prediabetes and diabetes are being managed. So your fasting blood sugar it's going to tell us how much sugar is still in your blood after you have not been eating or drinking. So when you're coming in for your fasting blood sugar, you'll be asked not to eat or drink for about 8 to 12 hours. So usually we say, come in and get it done first thing in the morning. That way, you haven't eaten or drank throughout the night. You can come in and get your blood work done before you've had any breakfast or anything to eat that morning. And ideally, the target for the fasting blood sugar is to be between 4 and 7. That's what we're looking for. If it's above 7, then it's just sitting a little bit high. Your hemoglobin A1C, or you might hear it referred to as your A1C, is another blood test that is used regularly, as it can show how your blood sugars have been for about the last 3 months. This is measured by looking at the number of sugar molecules that are attached to your hemoglobin cells. So hemoglobin is a cell in your bloodstream that delivers oxygen throughout the body. And sugar molecules are really sticky. So some of those sugar molecules will stick to the hemoglobin molecules as they both travel throughout the bloodstream. So if there's a lot of sugar molecules in the bloodstream and your blood sugar is high, then more of those sugar molecules will stick to the hemoglobin cells and your hemoglobin A1C will be higher. So it can really help to almost think of it like a candy apple. So if your blood sugars are high most of the time, then more sugar molecules will stick to your hemoglobin, which is the apple, and that candy coating will be thicker. So vice versa, if your blood sugars are within a normal range more often, then there will be less sugar molecules in your bloodstream. So less of those sugar molecules will be stuck to the hemoglobin, and that candy coating will be thinner, and your hemoglobin A1C will be lower. So that's really kind of what we're looking at. It really does give us that idea of what sort of range your blood sugars have been in over the last 3 months. The target for the hemoglobin A1C for someone with diabetes is to keep it at about 7% or lower. Your target A1C may be slightly different depending on your age and overall health. So if you'd like more information about what your specific hemoglobin A1C target should be, you can ask your healthcare provider. But here's a question that we get often, and it's, do I need to fast before having my hemoglobin A1C checked? So the short answer is no. You do not need to fast to get your hemoglobin A1C checked. Eating and drinking will not affect that hemoglobin A1C because it's looking, like we said, at sort of that 3-month picture. So whatever you ate or drank that morning will not affect your hemoglobin A1C. You'll only need to fast to do your blood work if you have been asked specifically to fast because you're going to get a fasting blood sugar done. So the next thing that we also look at regularly, we usually check this at least once a year, is your cholesterol levels. So the cholesterol is broken down into different parts. There's the LDL, which is the bad cholesterol. That's going to be the cholesterol that's going to kind of stick to the inside of your blood vessels and can cause clogs and does increase your risk of heart attack and stroke. The HDL is that good cholesterol, so it is going to actually help to clean out the bad cholesterol. So you want that to be a bit of a higher number so that the more HDL that you have, that it's going to help clean out the LDL and keep things from getting clogged up. And then the triglycerides, they are high levels of, they're a blood fat. So high levels of this blood fat called triglycerides can increase your cardiovascular risk. So we want to keep that nice and low as well. So this is always a really good sort of picture. It just shows that LDL is really the bad one. It's laying down all that gunk in your blood vessels. The HDL is helping to kind of clear it away and keep it nice and clean. So the main number that we always look at is the LDL specifically, and we want to target for that to be less than 2. So that's going to be our main target when we're looking at cholesterol. Blood pressure. So blood pressure is a really important one as well. Your heart's a pump and your blood vessels are the pipes. So when your heart is pumping, it is pushing that blood out of your heart and through your blood vessels. And your blood pressure is really telling you how much pressure it's putting on those blood vessels when it's doing that. So that top number, the systolic, is the amount of pressure in your blood vessels when your heart has pumped. And the diastolic, that bottom number, is the amount of pressure on your blood vessels when your heart is relaxed. So a high blood pressure can actually increase your risk of heart attack and strokes because it's putting so much pressure on those blood vessels. So we do want to try and target to keep it nice and low. And our target for blood pressure when you have diabetes is going to be less than 130/80. So you're going to have your blood pressure checked regularly at your diabetes visits. It's also important to keep an eye on it at home if you're able to, with a home blood pressure machine, and just make sure that your family physician knows if your blood pressure is often above this target of 130/80. Then you do want to make sure your doctor's aware of that. Okay, so those are all the numbers that we look at, the things that we're trying to keep at target to help keep you healthy and reduce your risks of complications. So here are some things that you can do to help live healthy with diabetes. So some things that you can do to help improve your health. The first thing is, of course, physical activity. Regular physical activity is one of the most important things that you can do, especially in terms of lowering your blood sugar. We like to almost think of it as another medication because it can affect your blood sugar so much. Increased physical activity can actually work just as effectively as some other medications in keeping your blood sugars low. And if you have prediabetes or you're at risk of developing type 2 diabetes, regular exercise can actually help delay or even prevent you from developing diabetes. So it's really important. Some benefits of physical activity, of course, are It can improve your quality of sleep. It can increase your self-esteem, your energy levels. It improves your heart health. It can actually increase your insulin sensitivity. So that one's the really important one. It can make your body use the sugars more efficiently and reduce your insulin resistance. And it can also increase weight loss. It can decrease stress. It can decrease joint pain, fatigue, your cholesterol levels. It can decrease blood pressure, and it can decrease those blood sugar levels, as we mentioned. It can also decrease glucose production from the liver. So the liver does produce its own sugar, and physical activity can decrease how much of that sugar your liver is producing as well. So how much physical activity and what are you expected to do? Really, the main thing that we always encourage is the recommendations are for adults to aim for about at least 150 minutes of physical activity a week, where you're getting your heart rate up and you're keeping it up for at least 10 minutes at a time. So that can be, it doesn't have to be big things, but it can be even walking, taking an exercise class, going for a bike ride or a swim, doing some resistance training as well is quite important. But there's lots of things that you can do. So other ways that you can actually work on increasing your physical activity are things like finding an active buddy. So someone that is already active, ask them to bring you along. You can schedule it into your day. This one is a big one. You're more likely to follow through if you've got it scheduled into your day. And really find something that you like doing or try something new. So if you enjoy doing something, try to work that into your schedule. Walk whenever you can, park your car further away, take the stairs, all those things. Talk to someone that's included physical activity into their life and get tips and tricks on how they got started. Set small, attainable goals. Don't set too big of goals that you might not be able to accomplish. Start small, just by adding little bits of physical activity in at a time, and you're more likely to kind of keep that up. And make family time active. Try to find things that you can do with the family or friends. So another really important thing is quitting or reducing smoking. So if you do smoke and you have diabetes or not, one of the best things that you can do for your health is to quit smoking. And it can really reduce your risk factors for any of those other major complications that can come along with diabetes. But the big thing is nicotine addiction is really powerful and it's really strong. And cigarettes teach your brain to depend on the nicotine. So it can be difficult to quit smoking, and we know that. Medications and nicotine replacement therapy tools can really help with withdrawal symptoms and improve your chances of being successful with your quit attempt. We do have a program here at the clinic in which you can get up to 26 weeks of nicotine replacement therapy for free. And we do provide counseling as well. So please, if you're interested in quitting or even just reducing and you want some of that help, just call your family doctor's office and ask to be booked in with the registered nurse to get you set up with our smoking cessation program. As well as alcohol intake. So being aware of your alcohol intake and trying to keep it within the low-risk drinking guidelines is also really important at reducing your overall risks for things like there's an overall sort of cancer risk with alcohol, as well as it can decrease your risk of other issues. So for women, it's recommended to have no more than 2 drinks a day and no more than 10 in a week. Men get a little bit more, but it's recommended to have no more than 3 drinks a day or 15 a week. So just being aware of how much you're drinking and trying to stay within those guidelines. As well, you want to make sure that you're really taking care of your feet. So especially when you have been diagnosed with diabetes, foot care is really important. Diabetes, as we mentioned, can cause nerve damage, and nerve damage is called neuropathy. So you can get neuropathy in your feet. It can also cause poor blood flow to the legs and feet. So you want to make sure that you're cleaning your feet and checking them daily. You want to also, ensure that your nurse is going to do your foot exam once a year as recommended. But if you ever have any issues with your feet, make sure that you're letting the nurse or the doctor know when you're here for your regular diabetes checks. There is a video in our series here on foot care with our other nurse, Erin. So please make sure you check that out, and she'll go over all the important parts of foot care. And then you want to book an annual eye check. So it is also possible for one of the risks with diabetes to be changes to your retina. So this is called retinopathy. And so it's really important to have your eyes checked at least once a year to make sure that there's no signs of this occurring yet. So it is covered by OHIP when you have diabetes to get your eyes checked yearly. You just need to make sure that you tell them when you go for your appointment that you do have diabetes, because they're going to do specific tests looking for these changes. So that's really important. As well, if you ever notice changes in your vision, making sure that you're addressing that as well. All right, so that is it for part 1 of our Healthy Living class series. So please check out the next video with our registered dietitian, Carolyn. She's got so much information for you. And then if you ever have any questions with any of the stuff in these videos, please give the clinic a call and set up an appointment with either the registered nurse or Carolyn, the dietitian, for more information.